afternoon, everyone, and thank you all for being here. I'd like to first recognize the other distinguished individuals that are here with us today. Chicago Department of Public Health Medical Officer Jennifer Suh, Chicago Federation of Labor President Bob Ryder, wave your hand, Bob. Alderwoman and Chair of the Workforce Development Committee, Sue Sadlowski-Garza, Sue, and her mom. And SEIU local members Eduardo Bedolla, there you go, and Juana Figueroa. Today, we have reached an important milestone in our journey on with COVID-19. Since the first day the vaccines arrived in our city last year in December, we've been able to feel the warmth of light at the end of a very long, dark tunnel. We started vaccinating with our healthcare workers in Phase 1A. And then a month later, at the end of January of this year, we began vaccinating our frontline essential workers and our seniors. And today, we are excited to expand eligibility to all of our essential workers and residents aged 16 to 64 with underlying medical conditions. And as I've said many times throughout the pandemic, equity isn't just part of our strategy, it is our strategy. And that's why I'm excited to announce that today, in partnership with the Chicago Federation of Labor, we're opening this vaccine site specifically for union essential workers. You can clap for that. We all know this, you all know this, but it bears repeating. Chicago is 100% a union town. And it's our union essential workers that make up the backbone of the city. That's why we're especially proud that this unique partnership will create the first vaccine site in the nation run by the labor movement. As well as further our equity-based vaccination strategy by getting vaccines to our Black and Latinx residents who have disproportionately borne the brunt of this terrible pandemic, and have kept our city running by serving Chicago in essential roles. This site will be open to union workers who live or work in the city of Chicago, and it will not only serve newly eligible union workers, but those who were eligible under phases 1A and 1B as well. It's also expected to handle approximately 1,200 vaccinations per week and ramp up to 5,000 to 6,000 as vaccine supply increases. Interested union members should visit chicagolabor.org/vaccine. That's chicagolabor.org/vaccine. For over a century, unions have been trusted messengers with strong connections to our workers. And it's thanks to this partnership that we will be able to reduce vaccine hesitancy, advance our equity goals, and most importantly, get this life-saving vaccine to the workers who need it most. And let me also just say this, to the union members who are here, you see your brothers and sisters outside, down the block, anxious to get this life-saving vaccine. I want to thank you on behalf of a grateful city for everything that you have done every day through this pandemic, through thick and thin, working your tails off to make sure that we could deliver for the people in this city. So thank you all very much. And while Dr. Suh will go into more detail in a moment, I also want to take this time to emphasize to all of our residents what today's shift to 1C does and does not mean. What it means is that vaccine eligibility has now expanded to residents who have underlying conditions and all essential workers, and we will be eligible to continue vaccine for those who were eligible in 1A and 1B. What this means is about 84% of the adults in Chicago are now eligible to receive this life-saving vaccine. So if you are eligible under these early phases, and you did not take advantage of the opportunity, do not delay. The door is still open to you. Contact your health care provider or visit ZocDoc, that's ZocDoc, ZocDot.com/vaccine to get signed up. As always, continue to visit chicago.gov/COVIDVax, where there is a vaccine finder to assist people who are eligible for appointments. Additionally, if someone you know who is eligible under these phases, please do whatever you can to encourage them to sign up and get the vaccine, and help them by taking them to a vaccine site. Now, what the shift to 1C doesn't mean is that we have enough vaccine at this moment to accommodate every single newly eligible person right away. We are bringing about 1 million more people into eligibility. We don't have 1 million more doses coming to Chicago, but we are hopeful that the federal government will make good on what they have told us, which is that more vaccine is coming and on the horizon. So what I will just say is, be patient. Be patient, because you will get your turn. We are determined to make sure that we get every single eligible person in the city of Chicago vaccinated, but it will take time. But be patient, and we will get there. And all those that are newly eligible under 1C will be able to make appointments in April or May. We are confident of that. This shift also doesn't mean that we should stop doing what we know works to prevent the spread of COVID-19. Yes, we are indeed making progress in our mission of vaccinating our residents, but we are not out of the woods yet by a long shot. Right now, we are seeing a troubling uptick in our case positivity and daily case rates. Folks, I just want to tell you, it was about 3 weeks ago that we were still on a downward trend, and we were seeing daily case rates in the 200s. Today, we're over 400 average new cases a day. And our percent positivity, which was the lowest that it had ever been in the pandemic, in the twos, is now back to 4% positivity. This is obviously a very troubling trend that is being driven by adults 18 to 39 who are primarily on the north and northwest sides of our city, in our Lincoln Park, Old Town, Dunning, and Portage Park neighborhoods. We've also seen a number of outbreaks involving younger people among sports teams and as a result of bar crawls. And let me be clear, it's not the playing of the sports or being at bars that is causing these outbreaks. It's the risky behavior in those settings that's creating the problem. Not wearing a mask, not social distancing. So folks, we've got to get back to what we know saves us, saves our family, saves people in our network, in our community. So to everyone listening in right now, and especially to our young people, please continue to remain vigilant and keep your guard up. The actions that you take now will impact what we can all do in the future. We don't want to be forced to take any steps back, or worse, close things down because we haven't done what is necessary now to remain diligent. COVID-19 is still here. It is still killing people in our city every single day, so we have got to remain diligent. We've got to maintain social distancing, avoid gathering in large groups, wash your hands frequently, and continue, please, to wear a face covering wherever you go. That's absolutely essential. With today's shift to 1C and the opening of this vaccine site, have the potential to propel us even further toward our historic post-pandemic recovery. And ladies and gentlemen of organized labor, let me be clear. When we talk about a recovery, that recovery has to include you, has to include putting people back to work and opening up opportunities that have been shut down as a result of the pandemic. We want to make sure that everyone who is ready, willing, and able to work has a job and an opportunity to do so. So with that, I'm thrilled that we are making progress in getting vaccine, but we've got to remain diligent so that our reopening and recovery is as robust as possible. And with that, I'd like to open or invite Dr. Jennifer Suh to say a few words. Doctor?
Thank you, Mayor. Good afternoon. I'm Jennifer Sudd, Chief Medical Officer at the Chicago Department of Public Health. I'm excited to announce that today Chicago, on schedule, moves into Phase 1C and expands COVID-19 vaccine eligibility to all of our city's essential workers and residents ages 16 and over with underlying medical conditions. With this expansion, as the mayor mentioned, about 84% of Chicagoans are now eligible to receive the vaccine. Now, all essential workers, many of whom are union workers, and including restaurant employees, clergy members, construction workers, delivery drivers, and warehouse workers, whose hard work has ensured our city continues to endure despite the challenges of the pandemic, can get protected with the vaccine. With this movement forward into Phase 1C, we also provide protection to those at increased risk of severe illness or death from COVID-19 due to underlying health conditions. For example, individuals with cancer, diabetes, heart conditions, lung diseases, decreased immune systems, and pregnancy. A complete list of eligible underlying conditions and essential workers can be found on our city's vaccine website at chicago.gov/COVID-vax. Those already eligible under Phases 1A and 1B will remain eligible. Importantly, we must continue to prioritize our seniors who are particularly vulnerable to severe illness or death from COVID-19. To date, 55% of Chicago seniors have received a first dose of vaccine. And while this is progress, we must continue to keep focus on protecting our seniors as we move into this next phase. If there's anyone in your life who is 65 or older, please help them make and get to a vaccine appointment. As a reminder, appointment assistance is available for Chicago seniors by calling 312-746-4835. It's important to keep in mind that while the list of those eligible for vaccination expands, vaccine supply and appointments are still very limited. And as the mayor mentioned, patience will be key. As with our previous phases, Phase 1C will roll out over several weeks, and the vaccine will be offered to all eligible Chicagoans throughout April and May. As vaccine supplies increase, everyone who wants a vaccine will get one. Additionally, beginning today, to ensure Chicago residents can better access vaccine appointments in our city, City of Chicago-run vaccination sites will only schedule appointments for Chicago residents ages 18 and over. The best way to schedule an appointment remains by contacting your healthcare provider. If you don't have a healthcare provider, you can go to zocdoc.com/vaccine or chicago.gov/vaccine finder to find a vaccine provider nearby. While we've made great progress, especially in focusing vaccine outreach to communities hardest hit by the pandemic, as the mayor mentioned, we've seen some very concerning data of late. COVID-19 case numbers have been on the rise again, with increases in particular among young adults. In the last week, the city's test positivity rate has risen to 4%, and new daily cases are now over 400 when they were under 300 just 2 weeks ago. Vaccinating those at highest risk will have a big impact in driving case rates down. But we need to make sure we beat the race against the virus by continuing to wear masks, social distancing and not gathering in large crowds, and getting your vaccine when you're eligible. Thank you, and I'd now like to welcome Chicago Federation of Labor President Bob Reiter.
Thank you, Doctor. Good afternoon. My name is Bob Reiter, and I am president of the Chicago Federation of Labor. On behalf of the CFL's 300 affiliate unions, who represent 500,000 working women and men here in Chicago and Cook County, I want to welcome you all to the first in-nation vaccination center run by the labor movement for union workers. And You know, a bunch of you came here to get your shots today, probably didn't think you were going to get a floor show too. But what a better way to talk about what we're doing than to do it while we're actually getting the work done. And first I want to thank, in addition to the city and the mayor and CDPH, I want to thank my good friend now Osmond from Jewel Osco, all the pharmacists here that are putting shots in arms. They're members of Teamsters Local 727. And I also want to thank our partner in crime, Christina, from the Midwest Employee Benefits Coalition, who helped us coordinate and plan the event. And again, I want to thank Mayor Lightfoot and the Chicago Department of Public Health for their partnership in getting this facility up and running, and give a huge shout out to Operating Engineers Local 399 and their President and Business Manager, Pat Kelly, for welcoming us into their building again today. You know, every year, the Monday or the Wednesday before Labor Day, we would host a Labor Day luncheon, and we started that luncheon right here at 399. And who would have thought so many years later we would not be doing the luncheon, but we would be giving shots during a global pandemic, the second of which we've seen in this country in the last 100 years. And this past year has been incredibly difficult for everyone in our city. Union members have sacrificed their lives and their livelihoods each and every day of this crisis, either by risking their health and safety to go to work, or by being forced to stay home without a paycheck when they'd much rather be on the job. I've said this countless times, but I'm going to say it again. We owe these workers a debt of gratitude that may never be repaid. But today is a new beginning and a huge step forward out of the darkness of the past year toward a brighter future. This vaccination site is the first in the country that is run by the labor movement, specifically for union members. And yet again, Chicago is leading the way for the rest of the nation in standing up for working people, and we are truly proud to be part of that history. While we're on the topic of history, I have to mention that this year, 2021, is the 125th anniversary of the founding of the CFL way back in 1896. For 125 years, the CFL has fought for better wages, stronger workplace protections, and more safety on the job for working people in this city and beyond. We've seen it all in the last 125 years, from strikes to boom times, natural disasters to depressions. And again, like we did 100 years ago, we're facing a global pandemic. But through it all, no matter the emergency, there is one thing this city can count on. Chicago's union women and men will rise to any challenge to keep this city running. We've done it for the last 125 years, and we're going to do it for the next 125 years. We're going to be working with our affiliate unions over the coming days to make sure we can get the vaccination word out as quickly as possible and with a focus on equity. 2/3 of our members are black and brown workers, and we must do everything we can to get this vaccine into arms as quickly as possible. Unions are a trusted messenger in promoting vaccine uptake for workers, and we are actively communicating with our members to make sure they understand the importance of getting this vaccine. For those union members out there, you'll be receiving word from your local as soon as we have appointment slots, but more information can also be found at chicagolabor.org/vaccine. Again, I want to thank the City of Chicago and Operating Engineers Local 399 for their partnership in getting this vaccination site up and running. Please stay safe. I have 100 of these at least. Wear your mask. This is the new fashion statement for the new decade. Wear your mask. There is nothing wrong with wearing a mask, and if you're here at the right time, I may even get you a CFL mask, union made here in the Chicago area. Let's move this pandemic. Let's move past this pandemic once and for all. And now I'd like to introduce my good friend, daughter of oil can Ed Sedlowski, daughter of the steel mills on the southeast side of the city, my good friend and alderwoman of the 10th Ward, Alderman Sue Sedlowski Garza.
Thanks, Bob. I'm really proud to be here today to stand with the men and women across the city of Chicago that have kept this city moving. Our workers are the heartbeat and the backbone of our city, and it's important for us that we take care of them. So for them to be able to have a place to come that's run by and for union members is huge, because people trust their union. And when they say, my union's giving the vaccine, maybe I'll take it, it's a step forward, and it's a way for us to get out of this pandemic. I've talked to many of you today when I first got here, and we feel a sense of hope that we're getting a shot in our arm. But the mayor and Bob and the doctor are right. We cannot lose sight of what's important. It hurts my heart to think that the numbers are going in the wrong direction. We have to be diligent. We can't stop now. I want to thank Mayor Lightfoot, the Chicago Federation of Labor, the Department of Public Health, and the operating engineers, 399, for putting this together. This is such an amazing sight to see a place where union brothers and sisters can come for their vaccine. I don't think there's anywhere else in the city or even the country that is doing this. So a big round of applause for putting this together. I am very proud to introduce a brother in the struggle, Mr. Edward Bedoya, an SEIU Local 1 member who's here today to talk to us. And I want to tell you, Mr. Bedoya, thank you so much for everything that you've done to keep this city moving. Appreciate you very much, brother. Solidarity.
Muy buenas tardes, mi nombre es Eduardo Bedoya, soy un lavaventanas de los edificios más altos del centro de Chicago y miembro del SEIU, el local 1. Llevo 12 años en este oficio y lavo ventanas, tal como el 150 North Riverside, durante toda la crisis de COVID-19. Vivo con mi familia en Brighton Park, uno de los barrios de Chicago que más han sufrido debido a la pandemia COVID-19. Estoy aquí hoy preparado, entusiasmado y listo para vacunarme contra COVID-19. Diariamente pongo mi vida en peligro a cientos pies de altura en el aire para proveer a mi familia. Esta decisión es para agregar otra capa de protección y seguridad para mis hijas y mis 3 nietos que viven conmigo. La vacuna para mí significa proteger a los seres que quiero y los que están cerca de mí, de manera que no nos enfermemos unos a otros. Es urgente que miembros en nuestras comunidades se vacunen. Tenemos que protegernos unos a otros de manera que nuestras comunidades estén seguras para todos. Estoy muy complacido de conocer a la alcaldesa de Chicago, Lori Lightfoot, aquí hoy. Les agradezco a la Federación de Labor de Chicago, CFL, y a mi unión SEIU Local 1, por tomar las medidas necesarias para garantizar que los trabajadores esenciales, como yo, de primera línea, puedan vacunarse contra COVID-19. Por su atención, muchas gracias.
Good afternoon. I'm Lupita Aguila, the Director of the Residential Division with SEIU Local 1. I will be translating for Mr. Bedoya. Good afternoon. My name is Eduardo Bedoya. I am a window washer of some of the highest buildings in the city of Chicago and a member of SEIU Local 1. I have been a window washer for 12 years, cleaning windows like those at the building 150 North Riverside throughout this crisis of COVID-19. I live with my family in Brighton Park, one of the neighborhoods in the city of Chicago most impacted by COVID-19. I'm here today ready and excited to receive my vaccine against COVID-19. Daily, I put my life at risk, hanging hundreds of feet in the air just so that I could provide for my family. This decision is to add an additional level of protection and security for my daughters and my 3 grandchildren who live with me. This vaccine to me means protecting those that I love the most and those around me so that we don't make each other sick. It's urgent for members in our communities to receive the vaccine. We must protect one another so that our communities are stronger. I'm very happy to meet the Mayor of the City of Chicago, Lori Lightfoot, here today, and thankful for the Chicago Federation of Labor and my union, SEIU Local 1, for taking these necessary steps to guarantee that essential frontline workers like myself can receive the vaccine against COVID-19. Thank you.
When you hear the story of Mr. Bedoya and what he risked, literally life and limb every day, to be able to provide for his family, and how precious this vaccine is to someone like him, it really brings home the importance of how much we all need to do to make sure that we are really honoring his service and the sacrifices that he makes every day. So thank you so much for being here, and thanks to all the union workers for everything that you are doing to keep our city moving. Happy to take questions at this time.
Hi, Mayor. Heather Sharon,
How are you?
WTTW. Nice to see you again. I have quite a few, as you can imagine.
Okay.
Have you asked Governor Pritzker to take steps to address the imbalance of supply between downstate Illinois and the Chicago area? I've had a ton of emails from people who have driven up to 5 or 6 hours to get the vaccine. Is that something you've addressed with him directly?
We really have been talking with the state primarily through IDPH, but I've also had conversations with the governor about balancing out the supply, particularly, as you know, we continue to vaccinate a significant number of people that live outside of the city of Chicago but work here. Look, the bottom line is we got to get everyone vaccinated, but certainly those conversations about what we can do to share and lighten the load are important, and those discussions continue.
As you noted, today is the first day since mid-February that Chicago is averaging more than 400 cases per day, and Dr. Arwady said that would be an indication of significant concern.
Yes.
What are you waiting for before you start closing things down to stop this spread?
Well, it's not that we're waiting, but, you know, if you think about where we were a year ago and where we are now, we've learned a tremendous amount about this virus. Still a lot that we don't know, but we also know that we can do things in a more targeted way and not have to shut down the entire economy and our way of life to be able to address certain issues. So like we've done before, we try to obviously educate people into compliance, and we're doing a lot of targeted messaging at the age demographic and in the specific geographic areas where we're seeing the largest uptick. We're doing a lot of outreach to places where they frequent, like bars, like restaurants, but also gyms and other things. And we're hoping that we will see some progress through those outreach efforts. If not, then obviously we know other steps that we can take. But, you know, I said this when we finally were able to open back up. The last thing I want to do is have to close back down. We've seen that happen across the country. It is disastrous for businesses, for employers, for employees, and that's the last thing we want to do. So we're going to try to be a little more targeted and strategic with our intervention efforts.
Looking back to mid-February, is there anything you would do differently then if you had known that by the end of March, mid-March, you'd be facing a significant increase in COVID-19 cases?
Well, we've been very consistent throughout to make sure that we are reminding people that even though we were making progress, we were not out of the woods. I think in every public statement that I make about the pandemic, I talk about being in this long, dark tunnel. We're not out of it yet, and we won't be out of it for some time. You know, when I wake up, the first formal call that I have every morning is about COVID-19. The first voice on that call is typically Dr. Arwady telling us what the rolling averages are for cases, for deaths, for hospitalizations, for vaccine. So it's a very sobering way to start your day, but I am very, very clear, and I hope everyone else is in the sound of my voice, that we are not out of the woods. We've got a long way to go, and if we want to have a better summer this year than we had last year, we've all got to do the work now to make that a possibility.
From Franz Spielman of the Chicago Sun-Times, you authorized a $500 million short-term borrowing to buy time for Congress to approve replacement revenue to cities and states devastated by the pandemic. Now that $1.8 or $1.9 billion is headed to Chicago, will you cancel plans to refinance that $1.7 billion in debt, which will return the city to the era of scoop and toss?
We are looking at a range of different things that we will do. A significant portion of the monies that we're slated to receive are actually earmarked through specific grants, not unlike what we saw a year ago with the CARES Act funding. So we're going to get money for a lot of the public health work, and again, that's got specific strings to it. We're going to get funding for housing and homelessness and a number of other things that have very specific mandates on how those funds can be used. Obviously, we are getting discretionary funds, which we fought very, very hard to get. We are looking a lot at what happened in 2008 and 2009 when we had a similar but smaller scale economic meltdown, and making sure that we understand the past so that we don't repeat any of the problems. The city got a significant amount of money back then, spent it all on short-term fixes, and then was out of money and had to go to the parking meter deal, which we all know was a disaster and continues to be so for the city. And then after that money was quickly spent, had to have the highest property tax increase in the city's history. So we don't want to repeat that history. We absolutely want to look at ways in which we can address our structural fiscal challenges, but we also have people that are hurting all over the city. So striking that right balance, doing that in partnership with members of the City Council is something that we are continuing discussions about, but we haven't arrived at the specific formula that we will use in spending our discretionary dollars. But we've got to boost the economy. We've got to really give people, particularly those folks that aren't getting any and haven't gotten any monies from stimulus, like a number of our undocumented residents, we've got to make sure that we are using the money strategically to really kickstart the economy, but doing it in a fiscally responsible way. So we'll have more on that. I would expect it'll take us at least probably, first of all, we haven't gotten any money yet, and we're waiting on the Treasury guidance. So I would expect that we probably won't be taking a package to City Council at the earliest May, and it may not be till June.
From Amy Jacobson from WIND Radio, is there an update on the status of high schoolers returning to some form of in-person learning that you can share with us?
Yeah, I mean, we're working diligently on it, and our hope that at the start of the, very soon after the start of the fourth quarter, that we'll get our students back, probably in some kind of hybrid like we've done with pre-K through 8th grade. Go ahead, Craig.
Hi, Mayor. A couple of questions. We're understanding that President Biden is going to announce this afternoon that by April 19th, 90% of Americans will be eligible. Is Chicago going to be on track to meet that? Because we haven't complied with the state opening up. We've been kind of a little behind in that.
So I think I missed part of your question. To be eligible for?
The vaccine.
Oh. Well, as I said in my opening remarks, we don't have enough vaccine to be able to meet the demand, and I'm a firm believer that you can't create expectations that you can't fulfill. We've taken a gradual approach, which is consistent with the level of vaccine that we actually have been receiving. Our conversations with the Biden administration have been very promising. It's my hope that we're going to see an exponential increase so that April and May look a lot different, meaning a lot better with a lot more vaccine than what we've seen before, but we're not there yet.
My colleague Sarah Schulte is wondering about a vaccine passport. Is that something that you're considering to allow people to attend bigger events?
So that's something that's actually being discussed at the federal level, and we're certainly following those discussions. But would I be surprised at some point if venues, employers, other places say you got to show your vaccine card? There's some discussion about a national vaccine card. Obviously, there's a lot of privacy issues that have to be addressed before that becomes a certainty. I don't think we're close to that now, but that's been a discussion for some time.
Mayor,
Yeah.
Loretto Hospital is
Yeah.
wrapping up its internal investigation. You had mentioned you'd like to see an independent investigation as well. Where does that stand?
Well, my discussions with Loretto is that they were conducting an independent investigation. I think that they hired someone to do that. But the bottom line here is a couple things. Number one, Loretto's very important as a safety net hospital, particularly given the population that they serve on the west side. Obviously, they deviated from what I think is their core mission and what should have been the focus during this critical time period, which is driving vaccine exclusively to that west side population that's so in need and where we still have a lot of work to do to boost the numbers on the west side. I've had, I think, very productive conversations with members of the board, as well as the CEO, George Miller, before he was on his leave. We're committed to helping Loretto get it right because they're so important to the West Side community. But I'm anxious to see what the results are. This kind of drip, drip, drip in the media with a different story and all kinds of reports, that doesn't help them, but it also doesn't build confidence that they are a trusted provider of the vaccine, which I think that they understand.
And with this new report today that a doctor took the vaccine to a private home and vaccinated between 10 and 15 people, is it time for George Miller to resign?
Look, I don't think it's my place to tell Loretto what they should be doing with their personnel. They're going to have to make that decision themselves. But it's discouraging that there are so little controls on this precious supply of vaccine. And that's something that the board is absolutely going to have to deal with, which is why as soon as I heard the first story, I told them, do an audit, do it quickly, make it independent so it will be credible, but pardon the pun, rip the bandage off and come clean with what has happened with the vaccine that you were trusted with, so that it's not death by 1,000 cuts. And unfortunately, this thing has now lingered. I think we're in week 2 of this story. It's not helping anybody, and it's particularly not helping people have confidence that the hospital is doing what it's sworn to do, which is to really be a safe space for people on the west side who need connection to high-quality health care.
Mayor, a new study
Yes, sir.
puts the effectivity of the Pfizer and the Moderna vaccines at an 80% rate. Is there any, does the city have any idea of trying to start giving one dose of those vaccines to accelerate the vaccination process?
So my understanding is that there, and I'm going to defer to Dr. Suh, there's some discussion about and some additional studies being done to determine whether one of those vaccines, one shot of the vaccines is sufficient. But I'll let Dr. Suh weigh in here.
Yes, thank you. We are closely following all the new data coming out about the existing vaccines. At this time, we are still recommending 2 doses of the Pfizer and Moderna vaccines. That is what the emergency use authorization is for. But we are absolutely closely following the data, and if anything changes, we will let you all know. Thank you.
Dr. Suh? Hi.
Yes.
Asked last Tuesday if Chicago is in a 3rd wave of COVID. Dr. Arwady said that she certainly hoped not, and that CDPH epidemiologists were continuing to look at the data about the upswing. Do you consider us to be in a 3rd wave of COVID right now? Can you give any update about that?
Yeah, so we're certainly seeing a rise in cases. It's not to the point that we were seeing in November, but it's something that we want to closely follow. We're very concerned about what the outlook may be over the next 4 to 8 weeks. We still remain optimistic that if folks continue to do what they need to be doing with wearing masks, social distancing, not gathering, getting the vaccine when it's their turn, that we'll be in a better place in the summer. But closely watching the next few weeks because the cases have started to rise, as you know.
Thank you. Okay, Mayor? I wondered if you could comment on the developments of Tribune Publishing. There's a Swiss investor, Hans-Jörg Wies, who said that he doesn't want the Tribune, which could, quote, increase the amount of truth to the American people, to go down the drain. Another investor today in Florida has said that he's willing to put up $100 million into it. It's a niche thing for Chicago journalism, but I wonder what your opinion is about it.
Well, look, I think it's absolutely essential that we have a vibrant and robust Chicago media. There's no question about it, for all the reasons that you know, not the least of which is you keep people like me accountable. But I think you do a job that no one else can do, which is really to invest the time to sort through the facts and provide people with unbiased reporting. I have seen the developments over the course of the weekend about a new potential buyer for Tribune writ large, but specifically for the Chicago Tribune. I think that's a very interesting development. I also am very mindful of what Alden has done in other locations and how they have, their ownership has resulted in massive layoffs of reporters and a kind of coverage that is I think one of the words I saw in one of the articles is a shadow of whatever the newspaper's former self. That's something that we don't want here in Chicago. So I'll keep following very closely the developments. My hope is that the Chicago Tribune will continue to be a very robust daily and digital reporting platform that is not stripped of its essential core services and reporters. And I didn't just say that because Greg is here. Thank you, everyone.